Sorry. What I'm going to do is, obviously, starting off with this unit, we'll look at covering today learning outcome 1. And in this learning outcome 1, we're going to be focusing on things like, why communication as a process is important and how does communication work. So we look at some bit of theory in this in terms of understanding the process in general, where sometimes when we look at, speaking and listening, we do understand there are these only 2 aspects of communication, but we look at other forms of communication which are required when you're working in this sector as a healthcare professional. And we'll also pick out some bits of important legislation because of the confidentiality clause or things that we have to keep in mind when we work again within this sector because of patient client or patient doctor, patient nurse, patient healthcare professional kind of a confidentiality, because some of these things are discussed in person and it's expected that the person on the other side who's listening into this and tuned in to give some diagnosis or prescriptions, things like that, they are aware of the fact that there is this particular legislation which is very important. So data protection, and we look at some of these legislation of equality, diversity and things like that. And then the third and the last bit that we will cover is basically look at the different forms of structures which get formed within this sector in particular, because this is quite a large and a diverse sector. There are lots of functions, lots of services which are rolled out. So in this aspect, what we're going to look at is understand the bit in terms of what kind of structures are formed. In terms of if I simplify this, is looking at the basic aspect of when you work within teams, what kind of teams can be formed? Is it having a flat structure, a hierarchical structure? Who do you go to if you have a problem? How the problems are addressed, and what kind of an impact communication has on that structure? So sometimes you will feel that there are efforts by the government and the large bodies which kind of regulate this sector is to kind of de-simplify the whole process of organizational structure within the department. Say, for example, when we look at the NHS or healthcare in particular, and the idea is so that more departments can speak to each other, and what they do is the communication across the departments should flow seamlessly without delays, so that it leads to the action or leads to the response which is required from the HCPs and also other staff working within this sector. So the first outcome actually focuses on understanding the role of communication within an organization, what kind of policies and procedures are involved, and to a certain extent in this sector, what kind of legislation is very important when we understand communication within this context of health and social care. Yeah. Is that okay? Yeah. Good stuff. Now I'm going to go through some of the slides, and when you see some of the slides, I think in this particular presentation what we are looking at doing is covering just the task 1.1 and 1.2. There are some other slides which we will discuss as we go along. So if you have any questions, just stop me there, or ask me a question, and we'll discuss that in a bit more detail. Now, what do you understand by communication? Very basic. What do you understand by communication? Talk to the definition of it.
The definition, obviously, is communicating with each other. If that's via, I suppose my job, that can either be by talking or we get mood boards.
Correct. Absolutely correct. So basically, if I look at what you've given me is definitely an example, which is fine. But I think when you look at the whole the word communicate or communication, it is nothing but an act of or maybe a way that you want to convey something to the other person at some stage, whether it's an idea, whether it's a thought or a concept and things like that. So when a number of people get together, what they tend to do is obviously at some stage they use either hand gestures, you use verbal communication, you use non-verbal communication. It could be other mediums through written communication, for example. But the idea is, the whole concept behind the whole process of communication is that you want to convey something that you have at your end, and on the other side, when they understand, they tend to respond, and the response could be positive, negative, neutral, debate, discussion, things like that. So if we have to break this process down and understand what are the key steps involved in this would be, you will typically see somebody who's a sender. That means if I'm talking at the moment, I am talking verbally. But at the same point in time, what I'm trying to do is, I'm speaking, and that speech through some medium, or some sort of a medium in the middle, which is technology at this moment, is actually transmitting that over to your end, wherein you are the receiver and you're able to kind of understand what I'm saying, or at least hear me what you're saying, or hear and understand what I'm saying. And at some stage, when you respond, either a nod or when you respond back verbally, it actually completes the whole process of me talking to you, you understanding, and then you responding back. If it was face to face in the same room, it could have been that you're either nodding or you're kind of giving that impression that you've understood what is being spoken about. But in this case, because we are in different spaces, in different places, what is happening is you basically verbally feed back to me saying, yes, what you're saying is I've kind of understood, or it's okay to go further. So the process can be broken down into three things in particular. If I literally talk about sender, somebody who's a receiver, and then in the middle there is some processing of information happening using technology, whatever it is, and that is a step. And at some stage, if the other person responds back to you because I've asked you to respond, then there's a bit of a feedback which comes in, and that would then complete the process, saying that, okay, I'm saying something you've understood. In some cases, the fifth element which gets introduced, or the fifth step, is that if we are not able to hear, I'm saying hello, hello, and you're not able to hear me clearly, there's a bit of a distortion in the middle. And that could happen because of the fact, the way this signal is being transmitted, or the way the communication is happening. Sometimes you've seen that you're in the same room and you're trying to speak to the other person, but there's a lot of noise or discussion happening amongst other groups within the same room. And sometimes you feel, okay, can we move to a bit more quieter place? I think there's a lot of discussions happening. So that then tends to be noise or distortion. So the process, of communication was something which was, this whole stepwise process was something which was put together by Dressler, and it has 5 elements of it in this let's put it this way, in this whole conduit of somebody speaking and then somebody listening, responding, whether it's written, verbal, or non-verbal. I think it's pretty much the same, because of the fact that you have these 5 steps through which each time you go through and you speak or you communicate, you write, you have to go through this process. So after you understand how communication actually works, sometimes you will see that it's difficult to say that you can communicate with yourself. Sometimes you don't speak to yourself. Yes, but in some situations you do. Sometimes you will see that people, if they are not sure about something, or if they make a mistake, they talk to themselves to say, okay, I should have not done this. Why did I do that? Those kind of things. But in general, the whole process of communication requires at least 2 sides, so that one side is able to receive and the other side is able to transmit. And that then completes with some sort of a feedback coming in that the other side is able to receive. At some stage, we say the process of communication is complete. In World War II, if we look at, if we go back a few decades, we had Morse code, or, other ways through which we communicated. But those were, again, ways that if there was something which was sent as a code using transmission, and at some stage on the other side, if they did not receive the transmission or the message, like telegrams were used, I think, if we go back 50, 60 years, what we did get to see was that, okay, transmission happened, the radio signal went, but at some stage on the other side, the receiver did not receive it. So the communication on that side used to be, they used to respond back saying, have you sent the message? Have you sent the code? And, that is where there was a failure of transmission. And sometimes you did not have the message which was received or was not received by the intended recipient. So that concept is also applicable today, but what we get to see is that concept has got modernized with the use of technology, and we do see that sometimes there are physical barriers, which become kind of barriers to the communication being effective. in organizations, if I look at giving a example here, what will be is that sometimes you get a message from your supervisor or your colleague, and that asks you to do a particular thing. But the way you interpret that message, or the way you interpret that email or that communication, sometimes then tends to be that they expected of you that, okay, this would have been the output, but essentially the output is something slightly different. And that could be because of maybe some sort of a barrier in the communication. It could be that they have failed to communicate, exactly what was the message could have been ambiguous in the sense that they could not communicate effectively what was required to be done as an output. And you get to see this in organizations happening when, you will see that your immediate supervisor or a colleague or a manager has asked you to do something, but you end up doing something slightly different. And what the expectation was that, okay, this would be the output, but actually something different comes out of it. So these things that we look at are essentially termed as something called barriers. And barriers could be, or barriers in communication could come across from different, aspects. Sometimes it's to do with the communication not being clear and precise. Sometimes, so when I say clear and precise, that means you've said, sometimes you ask a question, are you okay? Yeah, I'm not too bad. So there is a way of responding. And when you say that, okay, I'm not too bad, that means there could be various interpretations of that. That could mean that you're okay, but you're not in a positive mood. It could be that you're fine, but you're not in a ecstatic or a very good mood. But sometimes the choice of words in terms of responses that you get could also be, something called barriers to communication. That means you asked a question, you said something, you were expecting a different kind of a response, but actually you elicited the conversation and actually got a different type of a response which you were not, expecting. And sometimes these are, barriers that you get to see, which tend to happen in, communication. One of the other things that you would see is semantics. What do you think is semantics? The meaning of semantics here?
I don't know that word.
Right. Okay. Semantics is nothing but a study of language. There are lots of students, lots of psychologists, a lot of people who study psychology at some stage study something which is called semantics. And semantic literally means it's the study of language. So sometimes you will see that, when you say something in a text, a sentence, or, otherwise, you will see that what tends to happen is that you will have words which will have similar meanings. So an example here would be that a typical example that you will look at is, say, for example, I'm going on a journey, but where are you going? I'm going to this destination. But some of the others would also say, use a choice of words, which will be saying that, okay, I'm going to this place, but that's going to be my last stop. And when you look at that, technically, destination and the last stop, you get to hear this, for example, if you've traveled in, say, a National Express or a train or a bus or whatever, sometimes you get to see these announcements which happen that this is going to be the last stop. So you are traveling from, say, Manchester to London or Manchester to Cardiff, and you know that, I'm going to get off at Cardiff. But the announcement that sometimes you see from the conductors or the person would be that this is going to be the last stop. And okay, people going on this train should look at the final destination is Cardiff, or final destination is, say, for example, London Euston. But they mean the same thing. But semantics uses these terms which kind of convey the same meanings, but they end up analyzing the shades of communication. The shade in terms of when I say I'm not too bad, I'm okay, they mean the same thing to a certain extent. But when somebody looks at studying language and the responses in general, they will analyze it slightly deeper to say that these words communicate, this, and this word actually communicates this in terms of a feeling or in terms of a situation.
Okay.
Is that okay?
Yeah.
Physical barriers would mean that, there are physical barriers sometimes in communication. That could mean that you're talking to somebody which is, within the same room, but because there are other conversations happening, there's a bit of a barrier. So, for example, physical barrier would mean a wall. You're talking to somebody in the middle, but there are somebody in the room, but there are lots of people in the middle, and that could form a physical barrier wherein your communication or what you're trying to reach across to the other person might not go clearly.
Yeah.
Loss of transmission. Sorry, go ahead.
No, I just said yes. I was just...
Loss of transmission, obviously, we faced something a couple of minutes ago while we're trying to do WebEx. So loss of transmission could be technology related. Example of, Morse code or telegrams, which were used in the earlier times. Sometimes you have that on the phone as well. You lose your signal while you're driving, you're talking, but you go through different cells and sometimes the signal drops off.
Mm-hmm.
Failing to communicate, there are people who try and sometimes you have to use language to articulate what you're trying to get across to the user. So there is something that comes across which means sometimes you're failing to communicate what you actually feel or actually mean. So in the case of healthcare in particular, you will have patients, people come across to you, sometimes they're feeling something inside, or they have a particular situation wherein they are trying to bring to describe that situation. They're trying to come across with words, but they are not exactly able to communicate what's happening. So sometimes you go to a GP and you try and explain your symptoms in terms of this is what is happening. I have a severe headache, and they try and then diagnose what exactly are the symptoms. So the GP or this doctor would actually ask you certain specific questions to try and relate to certain analogies in terms of what prescription and what medicines or what is the symptom. But it does happen sometimes you're failing to communicate. That means I'm having this situation wherein I get acute headaches, blood. Sometimes they go quite quickly. Sometimes I take a medicine, but you're not able to exactly pinpoint the reasons of why that headache is happening, or the doctor, the GP is trying to understand when does this happen? Does it happen in the morning, afternoons, evenings, at a specific time? And those are situations wherein sometimes you lose words or you're not exactly able to communicate what you're trying to feel. And we get to see this more often in the healthcare sector as against the other sectors, is because sometimes you say I'm lost, I've lost my words, or I was trying to say something and I've totally forgotten what I was wanting to say. So that means failure to communicate. There are sometimes competing barriers. What will happen is a typical example of this would be that when you look at technology in particular, wherever it's used within the healthcare sector, you will see that in certain places they ask you to switch off your mobiles, and the reason they ask you to switch off the mobile is because the same frequency might distort or kind of interfere with the other instruments which are being used in that particular setting. It could be a care home, it could be a nursing home, it could be a hospital, a surgery, things like that. And then there are other barriers that we look at. Sometimes there could be a cultural barrier, linguistic barrier, diversity barrier. You will see a lot of patients which come across from different diverse backgrounds sometimes are hesitant to discuss the problem until unless there's somebody present to mediate, or present to kind of give them that confidence and comfort that it's okay to discuss, it's okay to talk about it. And those are barriers which come across because of cultural diversity in the healthcare sector. So you'll typically see a lot of women, sometimes they shy away from discussing, or even males, they shy away from discussing certain conditions. It's because of the fact that they don't feel comfortable in the setting, or sometimes it's the articulation in terms of the language and the barrier because of the way they speak or the way they come from in terms of cultural background. They feel that communication, it's easy with some set of people, but it's difficult, and it becomes a kind of a barrier when you don't know the person, and and they are not able to discuss those problems or symptoms openly and quite freely. We do come across this as a barrier. Now this is very unusual, not listening. Now, if you're having a conversation, sometimes you get to see that when you go to GP surgeries and pharmacies and stuff, you get to see that they are so busy. Sometimes it's interruptions, things like phone calls, people coming in, or asking for parallel things. For example, if the patient is with the doctor and you get a knock on the door, the doctor has to respond, okay, come in, wait, or something like that, and you get to feel that at some stage this could cross over into being the fact that the doctor's on the phone or somebody's on the phone and you're also in that room, and you feel kind of you're being ignored. So sometimes you feel that this also becomes a barrier, is because you will see multiple activities happening wherein the person that you're working with or dealing with does not listen or does not have 100% attention towards you in terms of discussing the problem or the thing with you. So some of these are barriers which we get to see, which happen in the communication process, but the ones which we kind of can correlate to, when we are working with people within this sector, would be barriers which basically come across because of ambiguity, because of semantics, which is, sometimes you answer something, but the response that you give might not be the response which kind of helps clear that diagnosis, or, kind of confirm that diagnosis. Sometimes it's failing to communicate, and we also see cultural and diversity barriers more so within the healthcare sector as against other sectors. These barriers are common, but these are the ones that we get to see, more often than some of the others that I've discussed, which tend to happen within this process of communication. Is that okay?
Yeah.
Okay. Now let's look at, there are different forms of communication that we do. Now there are 3 different types that we can look at. One is verbal, the other is non-verbal, and then third is written. So these 3 different forms of communication that we do at some stage, have what you call some barriers as well. And you need to understand that within an organizational context, when you work with a lot of people, when you work with colleagues, peers, superiors, it is the most key element that helps you either understand or let the other person understand what you're trying to do or what you're trying to, accomplish. So non-verbal communication is one of the effective mediums that we look at, wherein sometimes when you're in a meeting, typically, or in a discussion, you will see that a lot of people just contribute by either nodding, using facial expressions, body language, and that then tends to kind of give you a clear idea in terms of what that person's thinking process is, or what they are thinking. Sometimes you'll get to see when you're meeting patients, they don't communicate much with you, right? So you have to be proficient enough to be able to pick up signs using non-verbal communication. And these could be signs which could be because if, for example, somebody's had a clinical procedure and has been transferred from, say from the ICU or the surgery to, operating theater, from that he's going into the ICU, or in those cases, the patient might not be able to communicate that much because of the condition. And there, the communication tends to be more of non-verbal, wherein they'll touch you, they'll clasp your hand, or maybe press your hand slightly harder to make you feel and understand that what's exactly happening. They look at facial expressions in particular. And that is where gestures, facial expressions, and this bit becomes more important. In a commercial setting, when you look at organizations, we get to see this happening within meetings, right? We get to see this happening within group discussions, or when you are working within teams, you get to see that sometimes you do not need to speak that much, and you can convey everything by, maybe if in a meeting, like for example, if I'm going through some of the slides now, I tend to ask this question again: is it okay? Is that understood? And if it was that if I switch on my webcam and I can see you and you can see me, sometimes the facial expressions, the expressions itself would be able to give me an idea that, okay, yes, the pace of the lesson is fine. What I'm trying to explain is being understood. And, there's a bit of a response coming in from the other party, or let's put it this way, the person that you're communicating with, and that tends to take the route of something called nonverbal communication. Is that okay?
Yeah.
Okay. Now, there are some barriers which also are applicable when you look at specifically, non-verbal communication. And those barriers could be something called psychological barriers. So here, when we classify them as, psychological barriers would be things like, say, for example, perception, experience, emotion, and defensiveness. So in some cases, what you'll get to see is that sometimes, even during having, say, for example, if you're communicating non-verbally by touch, or for example, through sign language, or otherwise through gestures, you will see that there will be barriers which will be affecting, your state of mind, or something which is your emotional state, because you're trying to convey something, but the other person on the other side is not able to understand your non-verbal communication. So it could be relating to, psychology. And in this sense, what tends to happen is you are looking at something which is to do with a physical cause in terms of why this tends to be a barrier. So it could be an experience in difficulty in understanding things which you have not experienced before. and that is something which is an experiential barrier. So for example, somebody who has a lot of acute pains or headaches and has been diagnosed with a particular condition, say like migraine or things like that, you will see that when they try and relate this to what exactly happens when they get an acute pain, there is a bit of a frustration, and sometimes you get to see that you're trying your best to explain things, but it's not something which is being easily understood by the person on the other side because they haven't had the experience of having that pain. So these sometimes are important, and again, the word that I would say is we get to see them more often in this sector than the other places, is because sometimes you have to understand the emotions, and you have to understand, or if you've had the experience of going through that pain, then you understand some of these things much more effectively when the patient, or for example the person that you're dealing with, actually uses non-verbal communication to get those things across to you, or get those facts across to you.
Mm-hmm.
Okay. We also look at a lot of interpersonal communication within this sector. Now, the reasons of focusing on certain aspects is because here, when we look at, say, different, let's look at a commercial organization. When we look at outside, what we do get to see is that you normally don't, change doctors, or you normally don't change, let's put it this way: when you are working with a patient, or when you're working with somebody, there is not, the person gets to know you as they work with you, or as you take care of them over a point in time. And there leads to a bit of a development of interpersonal relationship, which then also looks at developing interpersonal communication. And especially in the case of healthcare professionals, what we look at is that communication can happen at various levels. It could be professional, it could be, interpersonal, it could be departmental, it could be written, whatever it is. But the three different types, when we look at, we also see something which is interpersonal more so, which is, discussion happening between two different individuals, or happening, between two people. And here, the reason why this is termed as interpersonal communication is sometimes when you go to a surgery, you have a few, one or two nurses and a doctor within the same room, but they'll draw out a curtain to kind of, do a bit of diagnosis. So here, there's a bit of an exclusion which tends to happen between the other people within the same room, but at the same time, there's a bit of an interpersonal discussion which will happen between the doctor and the patient, or the person and the caretaker, to discuss things which cannot be discussed within the other set of people present in the room. And that then tends to be, because of that curtain being drawn out, if you imagine that, is primarily to look at, kind of segregating you from the others in that room. And that tends to be an example of something called interpersonal communication, because you want to show something, there's a bit of an attention which is required, or you want to clarify a few things which is only to be done with the consultant or the doctor or the care worker. And that then tends to get maybe more attention, because there's a bit of a doing away with the innovations, and also to a certain extent you lower your defenses, or do you lower your guard, because you want to discuss this in person and a bit more intimacy to make the person understand, so that they're able to either give you the correct diagnosis, or give you the correct medication, whatever it is. So interpersonal communication is also quite important within within this context, and this is one of the most let's say favored, or one of the clear sets of communication that we get to see within this sector. Now, if we look at once, let's look at an example that you've gone in and seen. So, for example, I'm down with cough. I have cough and cold and fever. It's not going away. You go into the surgery and you see the GP, and the GP would probably prescribe you, if they feel that it's a viral infection, whatever it is, and it's not going to go away. They prescribe you a bit of antibiotics and a couple of other things. Now, once that happens, you get a prescription, and then that communication is out in the open. That means it's more between a GP and a patient. But yes, once the prescription is given, you go to the pharmacist, you get the prescription, and then you're on your own in terms of taking the medication. If the improvement happens, then you're not back, obviously, to the surgery. But if it does not improve, then there are other people who will get involved. So there could be a repeat prescription. There could be something that you want to see the doctor again, because the situation has not improved, and he or she had asked to come back and see him in a week or something like that. and that tends to then allow other people within the context of the organization to get into that communication. So when we kind of move out from that subset of communication happening between two individuals to a larger inclusion of larger set of individuals within a particular setup, it could be the surgery, for example, it could be the pharmacy, it could be the hospital setting, and that is where you will get to see what organizational communication happens. That means the GP knows that my basic job is to look at the person, hopefully diagnose the problem, issue a prescription, and from then on, the appointment making, repeat prescription is all dealt by somebody at the reception, or dealt by the practice manager or by a particular nurse. And then that communication is now expanding into something which is a setup, and that setup could be a GP surgery, could be a hospital, could be a care home, could be a nursing home, things like that. And that is where the context of organizational communication then starts to happen, is because you're not just dealing with one individual, but you're dealing with a set of people who will serve or provide a certain type of service to you when you are receiving services from that particular setup. Is that okay? Yeah. And in that, what we look at is, you look at downward communication, you look at lateral communication, or horizontal as we call it, and you look at upward communication. So if you visit the GP and you've been with that surgery for a number of years, sometimes you feel that, I'm not getting the proper diagnosis, or I don't get prescriptions as frequently as I require them. You end up making maybe a complaint to the practice manager in the surgery if the surgery is big enough, or you end up making a complaint to a practice manager or a care manager, of a care home, because you do feel that there are things which, tend to slip more often than you would expect. So, for example, one-off case, not a problem, but if it keeps happening again and again, you end up doing, you say, okay, can I make a complaint, or can I put a suggestion down? And in those cases, then you expand your, area of dealing with people by looking at different types of communication within that department, within that setup. So downward communication is something when we look at, you're looking at somebody at the senior position speaking to staff at the junior position. So maybe if it's a practice, assuming it's a practice and there are 2 or 3 partners in that surgery, so they are maybe considered the top management, the practice manager, the people who work, the nurses, the practicing, all those people would then form, if there's a communication coming across from the practice manager, will go downwards, and that will be superiors communicating to, people to give them tasks, delegate jobs or things like that. And that will be an example of something called, downward communication. Lateral will be when you do communication across departments, amongst peers or amongst colleagues. So somebody at the reception dealing with, maybe it's a large surgery, you have 2 or 3 people working in the reception, and when they deal with themselves in terms of appointment allocation, repeat prescriptions, sometimes you see that, okay, in a larger surgery or a larger setup, what you will see is there are 2 or 3 receptionists or people at the reception who help out. One of them will say, okay, I'll deal with repeat prescriptions. That's the counter for repeat prescriptions. That's the counter for, the triage team. That's the counter for example, journal walk-ins or a walk-in surgery. So you get to see that there is lateral communication which will happen. That means they're all at the same level, and they kind of effectively work together as a team to try and ensure that the queue keeps moving, and the patients are looked after. And then if they are coming into the surgery for a specific thing, they get to be seen, in an orderly and a quicker fashion, if they know where they are going and if they know what kind of service they are looking at. So in those cases, you will see lateral communication. In a commercial setup, if I look at maybe an organization outside, so if you imagine going to, say, for example, a particular store like an H&M or a Next store, you'll find a lot of people working on the shop floor would basically be all colleagues or peers doing different things in different aisles or different places of the store, for example, the clothes department and things like that. They will have more or less, same sort of communication amongst themselves. But if the manager is to walk in and they say, okay, can you tidy up this aisle? Can you set this up here? Can you set up this promotion on this side? You will get to see a bit of downward communication happening. And sometimes you will get to see that there's a bit of an upward communication. That means people at the shop floor, people at the frontline services will also look at sending feedback in some sort of communication, which is primarily going as feedback going up. and that would be termed as something called upwards communication. Those typically things we get to see when we see feedback being drawn out in terms of appraisals, feedback being drawn out in general to improve services. It could be things like suggestions coming in from the receptionist or the practice manager, who knows that we between 8 to 10 or 8 to 10:30 we get so many patients every day at the surgery who come into the walk-in surgery. In order to better organize, what the receptionist or the people in administration would do is, okay, can we do this? Can we do this? Can we do an appointment booking? Can we open the telephone lines? And then that tends to be communication going upwards to try and seek approvals so that that process or that particular suggestion could be implemented. Now, in organizations, these next two slides give you an example of, depending on the setup that you work in and how big that setup is, how many people are involved, you'll typically get to see structures being created within the organization. And there are 4 different types of structures that we will look at some stage within this unit, and also in relation to the communication unit. There are structures which we normally term as matrix, hierarchical, functional, and departmentalization. So if we look at a large PCCT trust, which is taking care of 3 or 4 hospitals in a particular area, you will see a departmentalized structure. That means there'll be a few surgeries associated with hospitals, some bit of ancillary, community-based services also working with the hospital. And you will see that at some stage, there's a tiered level for each function to happen. And if it goes beyond their remit, they will transfer you over to the higher level or to the next level. So sometimes within these structures, what we get to see is formation of formal and social structures as well. So let's look at an example of a particular department within a hospital, and where you see a lot of nurses and doctors work together. What they tend to do is they work in shifts and they do their rota. But what at some stage would happen is that, okay, there's a formal rota being drawn up, but there are informal arrangements which tend to work between saying that, okay, I'm going to take a day off. Can I do this shift? Can you take over my shift? Or, those kind of adjustments which tend to be done, which has been done on paper. The formal structure is there. Okay, you're doing these days, but on certain days you try and end up exchanging your shift with somebody else because you have an appointment or you have some work to do. And that is where we get to see within these large structures or different types of structures that we will study in the organization, that you see formal structure working, but also at the same point in time, an informal or a social structure also present within that structure, which kind of lets things run more effectively without having to kind of disturb the formal structure which has been created in the in the organization. And there are different dimensions to it. So this particular slide is talking about dimensions in terms of let's look at the healthcare setting again. And within this setting, what we tend to see is that there is a lot of skills enhancement, trainings, updates which have to be done. So over a point in time, what has happened is that there is a knowledge transfer which needs to happen, so that everyone working within a particular team has almost the same level of knowledge in terms of dealing with patients. So it could be where some of these organizations then tend to allow the structures to work, but also create something called an intranet or a facility within which you can actually access information at a maybe touch of a button. So for example, if the doctors are engaged and the practice nurses also are engaged, sometimes people dealing with this information would primarily log into a particular knowledge network, and that knowledge network will have some sort of basic prognosis or a process of basic prognosis which the person can be taken through before they are handed over to a specialist or a consultant. So the creation of knowledge networks, apart from the formal structure in the organization, which is looking at hierarchical, functional, matrix, things like that, are also classified as structures because these structures, this particular field in general, medicine, care settings in general as a field, is knowledge intensive. That means there should be an easy flow of knowledge and information which could happen within departments, within colleagues, or within people working within the setup. And sometimes you will also get to hear a word called knowledge network. That means an intranet or a facility which is like a portal which allows people to log in quickly and then receive information or receive communication in a much more effective and a transparent fashion. Is that okay? Now, sometimes you will get to see that we have talked about some individual barriers in communication. Now we are looking at just briefly focusing on something called, organizational barriers. Now, sometimes if you work in a large setup or a large organization, you will see that there are, barriers that you have because of, authority or the task or, for example, the identity and also the culture of the organization. A simple example that I would give here is, for example, when you look at the policy of whistleblowing, within the department, sometimes within the medical setting or even within a corporate company or a large setup, you'll get to see that over the years, what the HR department has done is they've created something which is a policy, which is to talk about practices which are, being carried out, or, things which have kind of got formalized over the years, but do not conform with the quality assurance process of, the organization, or maybe some sort of a communication process within the organization. So that is where here, when we look at those kind of barriers, when we look at the policy of whistleblowing, is to basically break the barrier down. That means I don't want to conform with this. This is something that I don't agree with. It's not morally right. But what we tend to do is use that policy and the procedure to be able to come out in the open and kind of expose or explain something which is affecting work within the organization. So it could be because of the fact that it's been authority driven. So nobody has the courage to be able to talk back or feedback to the people in the management. And that could be a barrier because of the way the organization is set up. That means the culture within the organization could be more or less autocratic. That means one person dictates most of the functions happening within the organization and the delegation happens from him only. And because of authority or the autocratic style of functioning, that would mean that at some stage becomes a barrier because the person is not taking in feedback or is not listening to his colleagues and peers to be able to get work done effectively. So that is an example of sometimes you see barrier because of the culture, but also because of the authority of the person, not having to allow feedback to come in. It could be because of identity. It could be because of structures. Structures is because you will get to see if it's a large organization, it's a very complex structure. You have lots of tiers. So people working within the lower management or junior management are not able to feedback directly to people in this mid or the senior management, or do not have access, or there are too many tiers. Sometimes you will see that because of that structure being formed in the organization, you will see that it also becomes a barrier wherein decision making gets delayed. Sometimes information cannot be transmitted timely, or feedback related to a certain area is not communicated in time, which can lead to obviously other problems, but that is down to how big the organization has become. Sometimes you get to hear these words that, the organization has become very big and very complex. And that tends to be a barrier for it to be, work effectively or ensure that everyone is on the same plane as far as, the objectives are concerned, the vision and mission of the organization is concerned. So those are, barriers that we essentially look at the organizational level. And they can come across because of various factors. And these factors could be, sometimes you hear the word politically motivated. It could be because of the type of setup in terms of leadership and management style. So there could be, most organizations in this sector, in the healthcare sector, tend to work more democratically rather than being, having a leadership or a management style which is more of autocratic or, laissez-faire. That means generally colleagues, the leader will delegate the decision making to the colleagues. So it's more of democratic decision making style. And sometimes if you don't have this in this particular setting, what you'll see is there are organizational barriers which definitely come up, on that context. Is that okay? The next few bit of slides, self-explanatory, but I'm just going to skip that because, upward feedback, how does it happen? What are the clear things? So, for example, sometimes you don't get to see feedback going in from people in the front line to say people at the top management is because they feel that sometimes if they don't understand the job quite well, then in those cases, it could be a bit of an overreaction because the employee is new or they've not understood the policy and process properly. So they tend to kind of look at this particular process of, feedback going up. So the recruitment has not gone right. For example, the person has been recruited, does not have the skills to be able to work well. So sometimes this feedback has to go up, and there are ways in which this feedback goes up through appraisals, through the checks that are done from time to time when people are working before they are confirmed onto a particular role. Now, there are other ways in which feedback is also gathered within the organization, and sometimes you will see that an annual general meeting in AGM, which tends to happen, when they get feedback at the top level, when they have shareholders, the board members, and people from all walks of the organization participating in that meeting to kind of get feedback. And that mostly is an example of feedback going upwards. That means you'll have everybody contributing, and that medium of having an annual general meeting AGM would allow feedback to be going from the lowest level, from any level within the organization, straight up to the highest level. There are social meetings or gatherings that also happen. There are unions which publish newsletters and regular monthly updates, meeting updates which happen, and these are all ways and mediums through which you will see that feedback travels upwards. Sometimes you get into a meeting and somebody is doing a minutes of the meeting. The idea of having the minutes of the meeting could be multiple reasons behind it. Is that you will get to see that there are people who have had absences, so they will get the minutes of the meeting to bring themselves up to date with what's happened. Sometimes you'll see that these meetings are done because they're recorded for the purpose of creating records, and also to a certain extent, certain reason could be that sometimes when delegation of responsibility happens and roles and specific responsibilities are given, it is necessary for this documentation to happen. And then this documentation travels upwards, saying that, okay, this will go into your file, or this will go into, some sort of a record. And those cases could be, why sometimes you will see meetings are recorded. And these are, in general, mediums through which you can send communication upwards. Email could be one. For example, a lot of employees would send out emails because of a grievance which needs to be reported, or there's a discontent which has happened, or there's something that you're not happy with. You will send out an email and you will document this in the written form, is because at some stage you feel that my discussions are not yielding to results, and the feedback which has been given in a number of times, verbal feedback, has not kind of resulted in the right outcome. So it is necessary for you to be able to document this, and that would be written feedback going in, and that could be going into, say, for example, your manager, and then CC to HR or something like that. And those are areas when you look at, upward communication. Mm-hmm. Now, towards the end, what we want to be able to look at is, I'm going to try and skip through some of the slides, but let's look at specifically, after getting an understanding in terms of how communication works, what are the barriers, and then in the healthcare setting in particular, let's look at a few reasons why we look at it is one of the most effective tools which helps drive functions within the sector, and what could be the potential barriers at some stage within this particular context. So when you look at specifically the policies and procedures, for example, everything is documented. So for example, if you have to deal with a patient, there's a procedure for that, there's a policy for that, there's a there are basic things which have been put in place to ensure that in the quality manual or in the handbook, whatever we call it for a moment, these things are documented. So there's a process book which allows you to deal with every situation, and there is no way at any given point in time you're asked to do things outside the book. Because if it's something which is happening over a point in time, it'll be reviewed, the processes will be reviewed, and at some stage they'll be amended. There'll be additions to it or deletions to it, updates to it, and then it'll again come into the policy manual or the quality assurance manual. And that is what it is expected from everyone that they will tend to follow this when they do their daily duties. Now, there are some barriers that we could look at, or some areas in particular that we are going to discuss in the next few slides, which will cover and round this up as, from a healthcare context point of view. So one such thing that we look at is the aspect of, why communication becomes a barrier is because of the literacy, because of the culture, because of the language. So sometimes you're dealing with patients, you're dealing with people in particular, wherein it could be a barrier. Communication could effectively be a barrier because of the fact that they have a different background in terms of cultural background. They have a different language that they speak, and sometimes language turns out to be a barrier, that they are trying to express themselves effectively, but if English is not their first language, sometimes you'll get to see that they tend to struggle, and that is where they will need either an interpreter or a help of an individual to be able to kind of do that bit of translation and ensure that they are able to understand the person who's going to be looking at the diagnosis. The doctor, for example, the GP is able to understand what they exactly mean.
Yeah.
So in this field in particular, words have to be chosen very carefully because they can have different meanings, from a context. And a simple example that you would look at is if these words are, kind of understood slightly differently in conversations between doctors and patient, then it could lead to a wrong diagnosis or a wrong prescription being given out. And that is why, you will feel that sometimes when you go and see your GP or when you go to the surgery, the questions being asked are very simple, very open-ended questions. And these questions, the reason why they're open-ended and very simple questions is that they want to get you to be comfortable and also want you to respond to these questions non-ambiguously. That means they want a very clear communication to understand, okay, what is the problem? You say, I'm running, I'm having fever. So how long have you been having this fever? It's recurring. I have it for 2 or 3 days. It goes away. Take a few paracetamols. It goes away. So these are questions which are leading on to some sort of diagnosis, but they are very, very simple questions wherein the meanings of these words cannot be understood differently by different people.
Yeah.
Is that something okay? Is that something which you are able to understand?
Yeah.
Yeah. Okay. The other bit that we look at is sometimes when you go through this process, you look at we kind of hear this term which is called communication gap.
Okay.
Sometimes you will see that you get a bit frustrated, you get a bit worked up, and you say, okay, I think there's a gap in communication. And this gap in communication could be that when patient records are transferred from the surgery onwards, now that we have an electronic system, obviously everything is accessible. But if you step back and see a few years, back, because IT implementation across NHS never finishes. So, we are always investing in the new systems or better systems in the NHS as far as, the patient record keeping is concerned. Now, you do see that sometimes if you move areas or if you move towns, your records between GP surgeries do not get transferred over seamlessly because a few years back, these systems were very different, or every surgery or every, record was, every surgery had the right to maintain those records, but the system wasn't linked up in the back. So sometimes patient records did not transfer, or you had to actually go through that whole thing again. So you get to see this happening wherein if you are a patient and you have a certain condition and you always need repeat prescriptions, but assuming you've moved area or you've gone into a different surgery because of, say, for example, change of residence and things like that, sometimes you feel that you have to go through the whole process again of explaining why do you need repeat prescriptions. And that is where you feel, okay, there's a big communication gap. I think my records have not got transferred over. This is my condition. And you go through that whole process again of, coming to a situation wherein the full diagnosis is then available, and then, you get to that process. So sometimes this, in order to avoid this, again, the role of communication becomes important.
Yeah.
And you again look at that example of, sometimes you get to see, hear, touch, and, different forms of communication happening because of the fact that the other person is trying to get everything across to you in as much clearer fashion or, possible way. There are other ways that we look at communication, and sometimes these are in the form of clinical interviews. Now, why do we say clinical interviews? Assuming if it's an advanced stage of diagnosis, or you are diagnosed with a particular condition, in those cases, your normal communication is not enough, and it has to be reflected, or it has to be kind of substituted with some other tests that you are asked to take, and these tests then lead to certain results, and these would be classified as something called clinical interviews. So your GP has asked you to undergo a blood test, or some sort of a test which then gives a report, and these reports are then analyzed to look at understanding the symptoms of what you're going through. And sometimes these then are called clinical interviews. So say the process of going through a procedure, say for example, if you have to be operated, for example, and you go through a basic procedure, check procedure, wherein they will say, okay, do you have any other condition and things like that, and that is to ensure that the persons who are going to be looking at maybe the clinical procedure are very well aware of your conditions. And in that case, in order to substitute communication, there are formal sets of interviews done to understand each and every aspect before you undergo an operation, or you undergo certain sort of a clinical procedure. Mm-hmm. Is that okay? Now, sharing sensitive information, I think this is something that we'll take it up with the legislation, which is data protection and stuff like that. But you will see that sometimes you cannot request for your records from the surgery, or until you send a written confirmation, or you are able to access your records, but going through certain set of security procedures, process for you to be able to get that information. And this is because the information which is being sought or is being asked for is sensitive. So nobody else in terms of the relevant persons should have access to it. But apart from that, the patient information with regards to the demographics, or with regards to the conditions that you have, is only accessible between the patient and the client, or the doctor and the patient, or the practice manager and the registered people with the surgery. So again, here, communication, when you see from people working within the sector, the GPs, the nurses, the healthcare professionals, they are very sensitive to sharing information about different people, and they go through a certain bit of security checks to be able to discuss this with you, or discuss this with a representative in case if it's to be if translation is required, or if the person is not able to speak, then they get somebody else in a family member, like a person like a family member, to come in and do the bit of communication. But one of the clear things established in that process would be how the information is shared, sensitive information. Sometimes this could be that when you're trying to break in a news, or you're trying to discuss the impact of a treatment, again, this information is shared sensitively with the members of the family, or that family member, so that it gives them the sense of calm, but also gives them the confidence that the person looking into this is dealing with it effectively to come to the best possible outcome. Okay. You also look at the line of questioning. How do you get information from people that you work with within your sector? You do a certain line of questioning, isn't it?
Sorry, say again?
Well, within the sector that you work, for example, as a healthcare professional, sometimes to get information from patients or people that you work with, you have to follow a certain line of questioning, isn't it? You ask a certain set of standard questions to get them to become comfortable, for example, or do away with their innovations, or to develop some sort of an interpersonal relationship, so that they are then comfortable discussing things with you, isn't it?
Yeah.
So that could be a way which we call is something called line of questioning, is that you obviously start by asking a few details. Can you tell me your name? Basic things which sometimes you will ask them, where are you from, and how long have you had this problem? And this is something which is a standard line of questioning to get the person becoming comfortable with you in the conversation that you're going to have.
Yeah.
We look at other things like, for example, sometimes we do see that the communication that is required does not go in the right aspect, does not go as per plan. In those cases, what you do is you ask somebody else to intervene, you bring somebody else in to observe and say that, okay, because I do feel that this is slightly sensitive, and I would want a second person to observe or a second person to be present to be able to have that discussion. And in those cases, you will get to see, it could be because you're trying to make the other person comfortable. It could be training. It could be other reasons wherein you have, sometimes you see training doctors and, other people, training nurses, people who are working and training within the healthcare sector also present when some sort of a discussion is happening. But in some cases, it could be because of the fact that you want a second opinion because the complaint is being raised, or, there is an issue which is being discussed. So you have a second pair of eyes, or, somebody else within the room, which then is also selectively present to discuss and observe the discussion happening between two people.
Yeah.
And last but not the least, we all sometimes look at, empathy, in the sense that sometimes you convey things or you convey certain, aspects using empathy within dealing with the patients or the people that you take care of. And those are done primarily through it could be through non-verbal means, but in some cases, when you look at, there are clues which are given out or words that you carefully choose because you want to show that you're sensitive to the information that you're delivering, right? And again, this is a key area of training within the sectors, because most of it needs to, at some stage, you do end up saying that, you have to swallow a hard pill, or you have to give something which is very difficult for the other person to comprehend and understand, but you have to give it in a very soft and, in a way wherein you try and understand and visualize their situation. So you're showing feelings of empathy. Last, one or two other bits and pieces that we look at is sometimes you have to disclose news which is unpleasant news. And in those cases, what you do tend to see is that people with more experience, nurses or people working within the sector with a number of years of experience, are chosen to kind of discuss that with the patient, is because you know what kind of response that would elicit, and from that aspect, you want to be carefully choosing the words to give out that information. And in some cases, it is sometimes you have to disclose unpleasant or bad news, and that is done by more people who are more experienced within that sector, or more experienced within that department or within that team, and they are basically given that responsibility to do it.
Yeah.
And in general, when you look at, what are the other parameters which kind of affect communication within this sector, is that sometimes the type of disease or the severity of the disease or severity of the problem is also something which becomes a barrier, and that could affect the way communication is done, right? Sometimes we do see that when you look at treatments, in particular for cancer, for example, they say that if it's detected early, it can lead to full cure and, treatment at the right time, which can lead to full recovery of the patient. But if the severity at which it has been determined or has been diagnosed it depends on what type of communication you have with the patient, and with how many members, or for example, different members in the family, in the group or in the family. Sometimes gender, familiarity with the patient. So if you're new in the setting, if you're a new GP who has joined, or a new care worker who has joined the care home, you tend to develop these relationships to understand the patients and the people that you take care of, is because you want to at some stage develop familiarity or some sort of an interpersonal relationship, so that they are comfortable with you when you're around them, and they are able to speak freely when you discuss things and issues with them.
Yep.
Financial status, not really in our context, but yes, in some cases, when you look at private healthcare, when you look at emerging markets or countries wherein you will see that where healthcare is not free or the care is not provided by the state, then in those cases, the financial status of the patient, that means people who have more money can probably look at better care or better hospitals, but people who have less money, or for example are financially not capable enough to get private health care, then in those cases, sometimes you will see the status of the patient in terms of, getting these services also matters, because in certain markets or countries that we look at, wherein healthcare is not free, that then tends to become one of the parameters which affects, the communication. Social status, again, in countries where healthcare is not free, you will see that the social status of the person kind of tends to affect the kind of services they receive from this sector in general, and that is where again we see communication becoming a bit of a barrier because of their social status in the society.
Yep.
Is that okay? Yeah. Now, what I've done now is basically we've just very briefly discussed with a few slides, the learning outcome 1, to try and give you a bird's eye view in terms of what is communication, what are the various processes of communication, how does it happen within the organization and within the healthcare context, and to a certain extent, what are the barriers and what are the types of things which affect communication within the healthcare sector in particular.
Yeah.
Okay. What I'm going to do is obviously send an email of this presentation to you, but along with that, what I'm going to do is obviously send you a handout. Mm-hmm. The handout will be giving you, it's like, this is an overview, but that will be kind of meat on bones, giving you a bit of more reading material to understand some of these key topics that we've discussed, key terms that we've discussed in a bit more detail for you to be able to crystallize your understanding on learning outcome 1.
Okay.
Is that okay? Yeah. Now, on Moodle, we have, we have a lot of e-books which have been prescribed by ATHE in particular for this course. Now, for each, what we've done is, let me have a look. I think we have looked at a couple of books which are prescribed for this course. And those, they tend to cover, let's put it this way, they tend to cover the entire unit in absolutely, in depth and detail. Uh-huh. So what I'm going to do is, on people in organization, I'm going to upload a book here, which is recommended by ATHE, and that will cover all the topics that you see on this, unit specification, covering them in. Right. So what I'm going to do is, when I drop you an email, the presentation and the handout will be specific to what we've discussed. But in addition to that, I will specifically point out a few pages that you need to read through the ebook. Okay. And that will be helpful at a certain stage, at a later stage, when you start looking at doing the assignment. Mm-hmm. Is that okay? So yeah. In terms of, teaching and learning material, what I'm going to do is I'm just going to structure the course in a couple of minutes after the discussion and when we close the session, so that what you get to see is a bit of a yellow kind of a shaded box around the unit that we are. That would tend to give you an idea that okay, this is what the unit which is currently being covered. Is that okay?
Yeah, that's fine.
Then so it by kind of as of now, as you can see, it highlights that this unit that we are covering. I might move it slightly up because there is not any specific particular order. We will cover some of these units, and this will be the first unit that we are looking at. And I will upload the book, the presentation, and the handouts here, so that if you check back in about half an hour, you'll be able to see whatever I send you on the email will also be available on Moodle for you to look at and to read and to download and keep it as an archive as and when available when we go through some of these things going further in the session.
Okay.
Okay.
Yeah.
Brilliant. Any questions so far? Anything that you've you feel you need a bit more reading about, or anything that you've not understood for today's session? Let me know.
We've gone through quite a lot, so I think I'll just do the reading and go from there, and I'll just email you. I think you've covered quite a lot.
Yes, I think we've looked at learning outcome 1 today, but what I'm going to do is obviously when I send you a bit of a handout, that is something that you can look at, which is going to be directly related to the assignment brief. So on this unit, the documents that we've gone through just to show you is briefly again. So Word documents are basically downloaded to your machine. PDF will open, and PowerPoints will also be downloaded. Now, every unit that you will see will be organized from a aspect of the suggested reading list. It'll have a sample assignment which has been issued by the awarding organization. You'll have the unit specification which is here, which I've just shown you on the screen. And then I've just uploaded all the presentations for this unit that we're going through. But we've gone through today just the learning outcome 1.1 and 1.2.
Yeah.
Is that okay? And I'll
Yep.
send you some reading material for this, and I'll upload a book which is specific for people in organization or, people management in particular, which will have all the topics and the learning outcomes that we are expecting to cover in this particular unit.
Okay. Yep.
Brilliant. So now, what is the next? What date is the next session on then? Just to clarify.
Wednesday the 25th.
So Wednesday the 25th will be the next session. Okay. And then we are doing another one which is on the 27th.
Yes, 25th and 27th.
So that's fine. Okay. So I've got these invites here on my calendar, and I think what I will do is these are invites which are WebEx invites. So again, on Wednesday when we start at 11, what I'm going to do is try and come on a bit earlier. But my suggestion to you would be if you just double check on your end from an aspect of this particular application being installed. If you're using a Mac and I'm using it as well, you will see that when WebEx is installed, you will see this as a globe on the top.
Yeah.
Which will keep track of all your meetings. And I think all the invites that we send across, they come across with an iCal as we discussed yesterday in the text message. So you should be able to add it to your calendar.
Sure. Yeah. I've got the 25th and 27th in my calendar now.
That's fine. Brilliant. So I think it's just the application that needs to get installed somewhere on the Mac, and I think it's probably not happening. But just have a quick look through it, because sometimes when it downloads, you will see when you download, it comes up, as a small bar in the downloads folder somewhere here, and when you click on it, it asks you to drag the icon so that it gets installed in the application. So if it's not installed, that was maybe the reason why probably it was that it's still working on setting up your meeting. To the best of my surprise, I think it doesn't get installed in the dock, as you can see in the application. It just comes across on the top.
Yep. Okay.
In my case, I think in applications, at least when I look at it, I know that it's installed because I've been using it, but I don't see it myself in the applications anywhere as a kind of an icon. So I think it'll get installed, maybe a small icon near the taskbar on the top.
Yeah. Okay. Yeah, I'll sort that out this afternoon.
Brilliant. Thanks a lot for joining this session, Lindsay, today, and then I'll catch up with you on the 25th, and you'll receive the email in a couple of minutes from my end with the handout, and I'll upload the book here, which will cover the entire unit.
Okay, brilliant. Thanks very much.
Thanks, Lindsay.